Hello friends, good morning. Welcome to one more chest X-ray video. If you have any question in the normal chest X-ray, ask in the comments. Okay, we have already studied about the anatomical structures. This is a trachea and this one is a clavicle. Okay, these are the ribs and this one is the diaphragm and these are the lungs. Okay, this is left lung and it is the right lung. Okay, the heart is situated in the mediastinum. If you have any doubt in the normal chest X-ray, ask in the comments. Otherwise, okay, we will discuss the 20 X-ray of the different respiratory diseases and the cardiovascular diseases. Okay, what are the emergency cases? Okay, how to differentiate each X-ray? We will discuss one by one. If you give more support, we will discuss more video and more cases on our live streaming video. If you showing more interest in our video, just subscribe to our channel and join our membership. Okay, let's jump to the next abnormal chest X-ray. This is the image 1 and image 2. Okay, compare both 1 and 2 are same. Hello, good morning all doctors. Once again, welcome to our next live streaming video. In this live stream video, we will completely discuss all the chest X-ray. Okay, tuberculosis chest X-ray, pneumonia chest X-ray, and cardiomegaly chest X-ray. Okay, if you have any doubt, it is a trachea. Okay, this is a tracheal lining. You should see the clavicle fracture or the ribs displacement or any consolidation or any broncho changes. Okay, cardiomegaly. Okay, see the changes in diaphragm or any ribs fracture or the lungs alignment. If you have any questions in the chest X-ray, ask in the comments. If you first time visited our channel, just like this video and join our membership. Subscribe to our channel. Okay, next jump to the abnormal chest X-ray. What are the findings in normal chest X-ray? Are you understand? Yes or no, comment below. Okay, some of the doctors asking about the normal chest x-ray. Okay, it is a typical normal chest x-ray. Okay, first of all you see the okay patient details. What is the name of the patient? Okay, date and orientation. Okay, it is a projection of the x-ray. It is anterior, posterior or posterior, anterior. Okay, trachea is at the center. You should observe and see the any focal opacities. Okay, we will see in the upcoming infiltration or the pneumonia cases. Okay, the pleural effusion cases. Okay, we will see the consultations and masses or any foreign bodies inserted in the lower respiratory tract. Check out. If you have any questions, you can ask in the comments. Hello doctors, if you have any questions, ask in the comments. Otherwise, we will go for the next abnormal chest x-ray. Okay, first one is see the patient details and image quality. Okay, next one is see the check the airways. Okay, cranial visible or main bronchi patient. The patient is about the mass or the tension or the pneumothorax. Okay, tracheal and alignment. Trachea is at the center and carina is visible. Okay, third one is see the breathing pattern of the patient. Lungs are appear radiolucent black, normal vascular masking, no focal opacities. Okay, and any consolidation or masses in the chest x-ray and no signs of the pneumothorax. Okay, no visible pleural line with the absence of peripheral lung marking. Next one is see the cardiac marking. Okay, the situation of cardiac in the mediastinum, normal heart size. Okay, cardiothoracic ratio less or more than 50% on the PA film. Okay, well smooth, well defined borders, normal mediastinal width. Okay, are there any cardiomegaly cases? Okay, or it is having any stunt or the any foreign body is inserted. Okay, see the any cavities in the thoracic region. Okay, next one is we should observe the pleural line. Okay, pleural line and pleural alignment, no pleural effusion, pleural thickening. Okay, no pleural thickening or the no case of pneumothorax. Okay, we should check in the immediately when you are getting a first time x-ray reports. Hello doctors, are you getting any difficulty to understand the chest x-ray? Ask in the comments. Okay, next one, see the mediastinum and hyla. Okay, the mediastinum and hyla, the normal sized pulmonary artery. Hyla is not enlarged or asymmetric hyla. Aortic arch is normal, or okay, no mediastinum widening. Okay, it is a normal film, normal chest x-ray. Okay, check the mid clavicular lines and okay, flatten diaphragm. Okay, we'll discuss about the diaphragm. First understand okay, the mediastinum and hyla arrangements. Okay, what are the normal levels? If you have any doubt, you can ask in the comments. Okay, mostly the chest x-ray is advised in the lower respiratory tract infections or the respiratory diseases, okay, heart diseases and cardiovascular issues, or okay, the cardiac patients, okay, the severe SOB patients, x-ray is must and need. Okay, next one is see the bones. Okay, the 12 ribs, the intact ribs and clavicle, scapula and okay, spine, no fractures or the lytic lesions, bone deformity, any bone deformity we should check. Okay, normal soft tissue shadows, no subcutaneous emphysema or no masses have been examined. Okay, okay, quick revision of the chest x-ray. Okay, what are these changes? If you know, comment below the answer. What are the changes in this x-ray? Okay, next we are discussing about the abnormal chest x-ray. Okay, every chest x-ray should examine okay, ABCE, airway, breathing, circulation and diaphragm, and okay, everything along with the bones and soft tissues and foreign body. Okay, in airway we should check the trachea lining, and in breathing okay, lungs are clear and normal marking. In C the okay, nothing but circulation. Okay, heart size, and heart is size is normal and mediastinum is normal or any cardiomegaly. Okay, D is nothing but the diaphragm. Okay, the sharp angles and proper height of the diaphragm, alignment of diaphragm, okay, and other things. Okay, the along the consideration of the ribs, bones, soft tissues and any foreign body. Okay, inserted coin inserted. Okay, in some cases we will see the small children are okay having the coins in their respiratory block. So in that case okay, for the seeing the okay, correct position of the coin, we should do the okay, chest x-ray. If you have any other doubts in the chest x-ray, you can ask in the comments. Hello doctors, if you have any questions, ask in the comments. Next we will see okay, what are the cases. Okay, the chest x-ray is must. Chest x-ray, okay, investigation of the chest through the x-ray, okay, is very important. In which cases? I have already told. Okay, in the lungs collapse or okay, fibrosis, aortic aneurysm, mediastinal masses, mediastinum. Okay, shift in the mediastinum. Okay, some doctors asking about the consolidation. Okay, what is the consolidation, in which disease? Okay, we will see the consolidation, we will explain. Okay, in the next pneumonia case. Okay, pneumonia or the alveolar hemorrhage in pulmonary edema. Okay, we will see the consolidation. Okay, yes, in lungs cancer also. Okay, chest x-ray is must. Yes, TB. Okay, TB, pneumonia, pleural effusion. Okay, all the cases we will discuss in this live streaming video, so be connected with us up to the end. If you first time visited our channel, please subscribe to our channel and be connected with us. Okay, it is abnormal chest x-ray of the pneumonia. Hello doctors, if you know about the pneumonia case, what are the signs and symptoms of pneumonia? Yes or no, tell me in the comments. Okay, we will upload the different chest x-ray films on our short video also. You can check out on our channel. In short video we have already uploaded the different abnormal chest x-rays. Yes, in COPD, asthma, lung sepsis, fungal infections, in pleural effusion, pneumothorax. Okay, any hemothorax, pleural thickening or the pleural plaque. Okay, cardiomegaly, heart failure conditions. Okay, in vascular abnormality, pulmonary embolism, aortic diseases, and diaphragm abnormality. Okay, chest x-ray is must. What are the changes in the pneumonia? Okay, how to differentiate the pneumonia chest x-ray? Okay, let's discuss. If you already know about the pneumonia case, yes or no, tell me in the comments. Okay, whenever you are getting the chest x-ray film, you should check the, okay, it is an anterior posterior or posterior anterior projection. Okay, the tracheal alignment, all the, okay, ribs are in intact. Okay, diaphragm position, and check for, okay, any cardiomegaly. Okay, in most of the pneumonia cases, okay, we'll see there is, okay, consolidation, homogeneous opacity, air bronchiograms, air filled bronchial seen in the against the opaque alveoli, no volume mass. Okay, second case of pneumonia is a lobar pneumonia. In lobar pneumonia, we will see the dense lobar opacity, large sharp margins formed by the fissures. Okay, and one more condition we will see in the lobar pneumonia, is a Silhouette sign. Okay, what is the Silhouette sign? Loss of border of the heart or the diaphragm depending on the lobe. Okay, it may be the right lobe or the left lobe. In most of the cases, okay, we'll see the changes in the left lobe. Okay, it is a slit heart sign. In slit heart sign, okay, we'll see right middle lobe obscures right heart border, right lower lobe obscure the right diaphragm, left lower lobe, okay, obscures the left diaphragm, okay, and lingula obscure the left heart border. And check for the bronchopneumonia. In bronchopneumonia, okay, bronchopneumonia, it is a film of tuberculosis. Okay, first we'll discuss what are the cases, okay, we can findings in the pneumonia case. Lobular pneumonia or the bronchopneumonia, the patchy scattered opacities and often bilateral or asymmetrical changes, no clear lobe lobar boundaries. Okay, we'll see in the lobular pneumonia, okay, or the bronchos pneumonia. We commonly see the in lobular pneumonia or the bronchio pneumonia seen in the staph aneurysm or the gram negative infections. Okay, next one is the interstitial pneumonia. Okay, after the bronchopneumonia, fourth one is the interstitial pneumonia. We'll see the reticular or fine nodular interstitial patterns, perihilar haze seen in the viral infections and mycoplasma infections. Okay, we'll see the interstitial pneumonia. Okay, we'll see fine nodular interstitial pattern or the reticular patterns. Next one is fifth case is a round pneumonia. Okay, we'll see the round pneumonia in the children's. Typically round and well defined opacity, and typically in the posterior lower lobes. Okay, in lower lobes we'll see the round well defined opacity. Okay, mostly seen in the children's chest x-ray. If you have any doubts in the pneumonia chest x-ray, you can ask in the comments. Okay, we all know right lung having the 3 lobes and left lung having 2 lobes. Okay, I am getting roughly. And in the pneumonia case, finally check the any cavity is present, area of cavitation within the consolidation. It may show the air level or fluid level. Okay, and see for the staph aneurysm or the clebicia or the tuberculosis or anaerobic aspiration. Okay, what are the complications we will see in the pneumonia? Hello doctors, are you getting my point? Okay, pneumonia will see the fluid are filled or the pus is filled in the lower tract of the lungs. Okay, some are asking about the definition of pneumonia. If you know the pneumonia definition, comment below. Okay, lower respiratory tract infections. Mainly, okay, pus is filled in the lower respiratory tract. Along with the okay, the severe SOP we will see in the pneumonia case. Okay. The final, okay, what are the examination we do in the pneumonia are the mainly see for the okay consolidation, bronchograms, or the okay the air is filled in the lungs, or okay slit heart sign. Okay. If you have any doubt in this pneumonia case, you can ask in the comments. Okay. If you have any other doubts in the pneumonia case, you can ask in the comments. Okay. What are the abnormalities? We'll see in the tuberculosis chest x-ray. We'll discuss in the okay next live streaming video. If you have any questions in the pneumonia chest x-ray, ask in the comments. Okay, once again I'm telling, first we'll see the okay consolidations. Okay, homogeneous white opacity, no volume loss. It may be the okay segmental, lobular, or diffused consolidation. Next we'll see for the okay patches infiltrate. It is a irregular or scattered opacities, typically in the okay bronchopneumonia. Okay, patches, white patches. We'll see in the bronchopneumonia. Third one is the okay round glass haze. Okay, early pneumonia or the interstitial pneumonia, we'll see round glass haze. Okay, next one, see for the there is any okay secretions or the visible dark branching bronchi inside the white opacity. Okay, alveolar filled with the pus or the fluid or the blood. Okay, seen in the lobar pneumonia and severe bronchopneumonia. Okay, we'll see for the pus or the fluid or okay any blood is filled in the lower alveoli, mainly seen in the okay lobar pneumonia and the bronchopneumonia, severe bronchopneumonia. Okay, third one is the check for the identify the distribution. Okay, which lobe is having the opacity. Okay, we are seeing the white patches opacity is seen in the which region, upper lobe opacity, middle lobe opacity, or lower lobe opacity. Upper lobe, middle lobe, or the lower lobe opacity. Okay, we have already discussed in the okay slit out sign, upper lobe opacity, it is upper mediastinum. Okay, lower lobe opacity seen in the right heart border, and lower lobe opacity okay seen in the obscures the diaphragm. Okay, and next one is a peripheral consolidation. Okay, the peripheral means okay the outer border consolidations we'll see mainly in the okay viral pneumonia or the okay COVID-19 patient or the encephalic pneumonia cases. Okay, we'll see the peripheral consolidations. Okay, fifth point in the pneumonia case is check for the loss of normal border. Check for the lost for the normal border. Right heart. First one is a right heart border lost. Okay, right heart border lost. Seen in the right middle lobe pneumonia. Left heart border lost. Seen in the lingular pneumonia. Right diaphragm obscure. Okay, we will seen in the right lower lobe pneumonia. Left diaphragm obscure will seen in the left lower lobe pneumonia. Okay, these are very important in the checking the borders of the heart, very important. Okay, these all are explained in the slut heart sign. Okay, remember I am telling, okay, second time, these all are explained in the still heart sign. Okay, if you have any doubt in the still heart sign, you can ask in the comments. I think you are getting any doubt, you can ask in the comments. If you first time visited our channel, please subscribe to our channel and be connected with us. Okay, check for the alveolar opacity, puffy opacity or the collapsing opacity, air space disease. Okay, there is a air is filled in the lungs. We'll see, okay, mostly in the bacterial pneumonia cases. Okay, check for the interstitial changes. Check for the interstitial spaces. Okay, reticular pattern. Okay, fine lines pattern will seen in the viral pneumonia and mycoplasma. Okay, nodular pneumonia. Okay, nodular pneumonia will seen in the miliary tuberculosis and in the fungal infections. Okay, we'll see the nodular pattern. Okay, reticular pattern will seen in the viral pneumonia and mycoplasma. Okay, nodular pneumonia or the nodular pattern will seen in the tuberculosis and fungal infections. Okay, okay, next look for any complications. Okay, what are the complications we will seen in the pneumonia case? Check for the pleural effusion. Okay, mediastinum is mediastinal shift or the large mediastinum, meniscus sign, blunted costophrenic angle. Okay, these are the signs of the pleural effusion. Okay, next one is the emphysema. In emphysema cases, okay, what are the changes in X-ray? The thick walled pleural collection will seen in emphysema, reticular shape pleura and does not changes in the position. Okay, these are the findings in emphysema case. Next one is lung abscess. What are the changes in the X-ray of lung abscess? If you know, comment below. In lung abscess, okay, we see for the round cavity and air fluid level. Okay, next one is the cavitation. The cavities, okay, we will see in the staph aura or the clebacia or in the tuberculosis or the anaerobic aspiration diseases. Okay, we will see the cavities. Okay, in pneumothorax, okay, we will see the due to the rupture or necrosis, we will see the pneumothorax, necrotizing pneumonia and pneumomediastinum. Okay, these are the rare complications. Okay, what are the complications we will see in the pneumonia are the pleural effusion, emphysema, lung abscess, cavitation and the necrotizing pneumonia, pneumothorax and pneumomediastinum. Okay, Okay, the final diagnosis is the, okay, in short trick for, okay, identifying the pneumonia case is a, there is a, okay, involvement of symmetry. It is the, okay, viral or the atypical pneumonia. Okay, if it is a asymmetrical involvement, it is, okay, bacterial pneumonia. Okay, bilateral patchy opacities. Okay, bilateral means both side, okay, patchy opacities we mainly seen in the, okay, viral pneumonia, mycoplasma and aspiration cases. Okay, what is the halo sign, what is the bulging fissure sign, round pneumonia we'll see in the, okay, children's, we all discuss in our, okay, upcoming opacity. Okay, upcoming live streaming video will discuss in the, okay, more details about the pneumonia. Okay, the quick revision about the pneumonia case. What are the findings in the pneumonia chest x-ray? See the, okay, first opacity, next one is the ear bronchiograms, okay, lobar locations and slit out sign, alveolar patterns, interstitial pattern and any complications. Okay, next one is the volume and distribution and special signs. Okay, these are the findings will important in the, okay, pneumonia chest x-ray finding. Okay, if you have any doubt in the pneumonia case or any complication, okay, ask in the comments. If you first time visited our channel, just subscribe to our channel and join our membership. Okay, our members get daily 10 MCQs and, okay, we'll discuss the AIA PGT previous year question papers on our members video. Okay, AIA PGT previous year question papers along with the, okay, our Samhita, Charaka Samhita, Shrushta Samhita and Ashtanga Hridaya we'll discuss in our, okay, only members. Okay, daily live streaming video. For getting daily live stream video, join our membership. Okay, all membership, you join our any membership, you will get, okay, all the video. If you have any questions, write in the comments. Okay, in next live stream video we'll discuss the how to find the, okay, the chest x-ray of tuberculosis. Okay, what are the changes in the tuberculosis chest x-ray, how to find, okay, what are the cavities and the bronchiograms and opacities. Okay, what are the changes we'll see in the tuberculosis chest x-ray, we'll discuss, okay, one by one all the points in the next live streaming video. If you have any doubts in the normal chest x-ray or the abnormal chest x-ray, you can ask in the comments. Otherwise we will end this live stream video. If you have any doubts, ask in the comments. Yes, it is a normal chest x-ray. Okay, I think you all know. If you are getting, okay, difficulty to read any chest x-ray, you can ask in the comments. Okay, here we are ending this live stream video. In next live stream video, okay, we'll discuss the What are the findings we'll see in the tuberculosis case, and heart failure and pneumonia case, cardiac pathology and cardiomegaly and COPD changes. What are the changes in chest X-ray in the upcoming video. If you know what are the differential diagnosis of this chest X-ray, comment below. Our upcoming live stream video is only for the subscribers and only for our members. So join our membership and get the all upcoming important chest X-ray and CT scan MRI report readings in easy way. If you have any doubts in the lower respiratory tract infections or the lower respiratory diseases, ask in the comments. Thank you so much for being connected with us and supporting our channel till today. We wish you all the best for all the doctors. All the best. Thank you so much for being connected with us. Thank you one and all. Myself Swamy signing off. Thank you one and all. Myself Swamy signing off. In next live stream video we will discuss the tuberculosis case.